Bismillahirrahmanirrahim. My name is Taraf Khan from 5th of morning, and the topic I'm going to present is rational and irrational use of drug. The drug which is given to me is Levamisole. Levamisole is an antihelminthic drug that was commonly used for the treatment of parasitic, viral, and bacterial infections. It was manufactured by Janssen and first used in 1969 as an agent to treat worm infections. Levamisole was approved by FDA in 1990 as an adjuvant treatment for colon cancer. It is a synthetic antihelminthic drug that belongs to a class of imidazole-thiazole derivatives. It possesses potent immunomodulatory activity. It has been extensively used in dermatology practice for the management of various dermatosis ranges for infections such as warts and leprosy, to inflammation to inflammatory dermatosis such as lichen planus and Behçet disease. The indications of levamisole are round-worm infection, hookworm infection, and nephrotic syndrome. Mechanism of action. As an anti-parasitic agent, the levamisole is an antiparasitic agent appears to be tied to its antagonist uh, activity towards L subtype nicotine acetylcholine receptor in nematode muscles. This agonistic action reduces the capacity of the male to control their reproductive muscles and limit their ability to copulate. As an anti-cancer drug, levamisole can stimulate the formation of antibodies to various antigens, enhance T-cell responses by stimulating T-cell activation and proliferation, potentiate monocyte and macrophage function, including phagocytosis and chemotaxis, and increase the neutrophil mobility and adherence, and obviously chemotaxis. What are the side effects of levamisole? The Starting from less severe side effects, this medication cause nausea, vomiting, diarrhea, mouth sores, loss of appetite, stomach pain, change in taste and smell, muscle aches, fatigue, dizziness, headache, and skin rash. So notify the doctor immediately if these symptoms are bothersome. Moving towards the less infrequent side effects, we experience these tend to have a severe expression. We have decreased blood platelets, as you can see here. We have low level of white blood cells, blood disorder, stomatitis, a condition where the painful swelling or sores are inside the mouth, or inflammation of skin due to an allergy. The rare side effects include low level of a type of white blood cell called neutrophil, confusion or paranoia, tardive kinesis. It's a disorder that is characterized by the involuntary movement of the face, mouth, and tongue, the presence of more cells than normal in the spinal fluid, and a yellowing of eyes and skin from the buildup of bilirubin called jaundice. Dose and dose adjustment. The usual adult dose for malignant disease is 50 mg orally every 8 hours for 3 days, starting from 3 to 7 to 30 days post surgery, may be given as maintenance therapy for 3 days at 2 weeks interval for 1 year. Interactions. So levamisole interact with different kind of substances. For example, for alcohol, levamisole HCl has been reported to produce anti-abuse like side effects when given with alcohol. With warfarin and phenytoin, some evidence show that levamisole can increase the effect of these drugs, but it is clinically uncertain. Irrational use of levamisole include the marketing, distribution, prescription, and use of levamisole which is defined by WHO guidelines. Irrational use can cause significant health problems in the current medical practices. Now we can are having alternative of levamisole. If it is not available, which brand or which drug we could use. In case of absence of levamisole, few alternative drugs can be substituted in the regimen. These drugs include praziquantel, ivermectin, fenbendazole. Alternative brands that are available for levamisole are Dewormase by GSK Pharmaceuticals in the price of 263. Then we have Antiworm Pharmacare Laboratories in the price of 33. Then we have Ketris by ICI Pakistan in the price of 241.25. Now moving towards the case study, soap notes. A flock comprising of about 55 animals was administered high dose of levamisole 6.78 at above 20 ml 3 to 4 times the normal dose by the farmer without prescription. The flock was immediately attended by a team headed by a veterinary assistant surgeon. The team observed that about 35 animals were severely affected. The clinical observed were depression, anorexia, seizures, ataxia, abdominal bleeding, and drooling of frothy salivation. The post-mortem findings observed were discoloration along with swelling of liver besides severe congestions of lungs, and the kidneys were presented petechial hemorrhages. Before starting, we should there's a point that it is levamisole is commonly used in veterinary medicine, so the case study is related to that. Now the subject, uh, a flock comprising of about 55 animals, that was the sub and 55 animals were the subject, and that were administered a high dose of levamisole by a farmer without prescription. And the symptoms or the objects apart from that we observe were depression, anorexia, seizures, ataxia, abdominal breathing, drooling of frothy salivation, discoloration along with the swelling of liver, and severe congestion of lungs. The kidney that was presented patriarchal hemorrhage. Now, assessment was that keeping in view the history, the clinical signs, and the postmortem findings, animals were treated with liver tonics and diso- uh, Dizona. Despite treating the whole flock, only 18 animals were survived, whereas 17 animals did not respond to that treatment. High mortality rate of 48.57 in the present study was due to late reporting of farmer and high anti-helminthic dose drenched to lambs having low body weights. However, the animals which survived were possessing good body conformation and relatively higher body weight. Now, the plan was that levamisole, that was an anti-helminthic of imidazothiazole class with immunosuppressant property. It was the recommended dose is 7.5 milligram per kg once orally, uh, and it was given. The adverse effect of levamisole overdose are attributed to narrow therapeutic index and stimulation of nicotine acetylcholine receptors, and subsequently reduction in convulsions threshold and paralysis of respiratory muscles and asphyxia. Now, although not available for human use, levamisole remains widely in use in veterinary medicine for treating worms in livestock and domestic animals. The drugs can cause agranulocytosis as well as vasculitis, which is prompted that FDA ban it for human use. These are the references where the presentation was taken. Thank you.